Welcome. Now we start with the lecture number 2 regarding the recent advances and in medicine as well as the recent update in Harrison 19th edition. Lecture number 2. In the previous lecture we learned a lot about the new advances in diabetes, so we continue. Now what else has come up and what are the other things that you got to know? First of all, we have one drug, so called Cinacalcet. Cinacalcet. This we use in secondary hyperparathyroid. Box number 1, Cinacalcet. Box number 1. Now, a very frequently asked question: what is the about secondary hyperparathyroid? This is a universal question. So, regarding secondary hyperparathyroid, causes, anything which lead to prolonged hypocalcemia lead to secondary hyperparathyroid. Okay, anything. So causes include number 1, chronic renal failure, and number 2 is like malnutrition like rickets and osteomalacia. Now, in both the conditions you get secondary hyperparathyroid. But what the difference is there? What happened to PTH? What happened to calcium and what to phosphate? In both the condition, PTH level is increase. Calcium reduce. But in CRF, phosphate is high, and in ricket and osteomalacia, the phosphate level is reduced. This is a very, very frequently asked question. This is the box number 2. Secondary hyperparathyroid is seen in such condition. Now we got one new drug, so called strontium. Strontium is the one drug. Strontium is the one drug that we are using for osteoporosis. Box number 3. Strontium we are using for osteoporosis. Now a new drug has come up, and this name is not given in 19th edition of Harrison also. That is mecaserimin. Mecaserimin. This is a new drug beyond 19th edition of Harrison. It is be used for if this patient, it is for for treatment of dwarfism due to growth hormone deficiency. Mecaserimin is a new drug beyond 19th edition of Harrison, wherever in a patient if there is deficiency of growth hormone. So we give this drug mecaserimin because it act on the insulin like growth factor 1 It acts on the IGF-1 receptor, that's why it promotes the growth. This is the new drug, box number 4, mecaserinin, new drug. Then we got certain somatostatin analog. Somatostatin analog. Somatostatin. Statin analog. And these two drugs, these drugs which you use in the treatment of acromegaly, somatostatin analog. We know very well that somatostatin is nothing but growth hormone releasing inhibitory factor. The other name is somatostatin. So somatostatin is nothing but growth hormone releasing inhibitory factor. So obviously it will reduce the growth hormone level, so we use in the treatment of acromegaly. The drug are octreotide and lanreotide. The name of drug is octreotide, lanreotide. This is the box number 5. Octreotide, lanreotide, they are the somatostatin analog. So we use in the treatment of acromegaly. Similarly, we got pegvisomant. We got one more drug, pegvisomant. Pegvisomant. And this is a growth hormone receptor antagonist. This is a growth hormone receptor antagonist. This is a growth hormone receptor antagonist. So obviously, we use in the treatment of acromegaly. We use in the treatment of acromegaly. Pegvisomant. This is the box number 6. So pegvisomant, right? Pegvisomant. They are the new drugs for the treatment of acromegaly. Now, new drug to treat SIADH. Treatment of SIADH. Drug is conivaptan. Conivaptan. This is an anti-ADH drug. Anti-ADH drug. So conivaptan is the new thing, is the recent update, is we use for the treatment of SIADH. This is the box number 7. Okay. Now we talk about some new drugs and for the treatment of medical adrenalectomy. Medical adrenalectomy. This is a very important question. Medical adrenalectomy. That means these are the drugs which reduce steroid synthesis. medical adrenalectomy. So these are the drugs which reduce steroid synthesis. Zoom करेंगे इसको, zoom करेंगे.
Okay.
So these are drugs which reduce steroid synthesis. It's a very important question. So let's see what are the drugs that are available. Number one, mitotane. Number two, aminoglutamide. Number three, metirapon. Ketoconazole. Then mifepristone. Now, few more drugs have come are trilocane. Trilocane. Then etomidate. Cyproheptadine. So drug we use for medical adrenalectomy are these one. I think this is box number 8 or 9, I don't know, but anyway, numbering doesn't matter. I presume it was box number 8. Okay? Drug used for medical adrenalectomy. Perfect. Now we got what drugs we use, which regime we use to treat. We used to treat malignant pheo. What regime we used to treat malignant pheo? Malignant pheo we use is Everbook regime. Everbook regime. In this we use dacarbazine, we use cyclophosphamide, and we use vincristine. This is the box number 9. Drug what we use is dacarbazine, cyclophosphamide, and vincristine. Okay. So now we talk something about the new drugs in rheumatology. New drugs in the treatment of rheumatology. New drugs in the treatment of rheumatoid arthritis. And whatever drugs I am giving to you, you will pakka get one question from this box in any of one of your exams, because they are widely discussed in all the conferences. So rheumatoid arthritis. The first category is TNF, alpha neutralizing drugs. TNF alpha neutralizing drug, they include adalimumab, etanercept, They include infliximab, TNF alpha neutralizing drugs. Second is interleukin 1 antagonist. Interleukin 1 antagonist. This include anakinra. Third, interleukin 6 antagonist. Interleukin 6 antagonist, tocilizumab. Fourth, tocilizumab. Fusion protein. This include abatacept. Fifth, we talk about anti-CD20 drug. Anti-CD20 drug, rituximab. Six, then we talk about newer immunosuppressive drug. Leflunomide. Leflunomide is the newer immunosuppressive drug. Friends, you'll pakka get one question from this box number 10. This is the box number 10. 100%, because these drugs are widely discussed in all the conferences. You're bound to get this drug, any other drug from this. Okay? Now we talk about few more drugs that we are using in case of gout. So new drug we are using in the gout are, first is new uricose, so treatment of gout. So new uricose uric drug. The new uricose uric drug is benzbromaron. The new drug is benzbromaron. It's a new uricose uric drug. 2. New xanthine oxidase inhibitor. Febuxostat. Is a new xanthine oxidase inhibitor. 3. We got drug rasburicase. we got rasburicase. This is one drug. It convert purine. Normally purine is converted into uric acid. Normally purine is converted into uric acid. Now what it does? This will convert purine into allantois. So this will convert urine into allantois, and allantois is a water soluble compound, so it will go out of the body. Okay, rasburicase. Then we have got three drugs. We got three drugs. That is losartan, then we have amlodipine, and fenofibrate. These three are the old drugs we are using for different purposes, but all the three drugs, they have a uricose uric action. They have a uricose uric action. This is the box number, whatever, I think 11, whatever it is there. Box, I think 11, whatever number it is. Numbering you can do yourself also. The box number 11. These are the currently available drugs. The treatment of gout also. Okay, gout also. You got many new drugs. Now I would like to tell you something about the prometric system, because you should know what is prometric system. Prometric system, it was recently introduced for last 2 years. Prometric system of evaluation. Prometric system of evaluation. You should know. As I told you, this has recently been introduced for the last 2 years. Now, before 2 years, whatever question you are writing, and they were all offline exam 2 years before 2 years, and each question, if you do right, you used to get +4. If you don't leave it, 0. If you do wrong, -1 was the usual marking in All India PG, DNB also, and there was negative marking in AIIMS also. But now the system has been abolished. Remember, in the previous system, each question was equally important. Now, and examiner knew that you all are reading routine guides available in the market, which are all B grade guides, and typical senior says read those guides and you will get PG. Now that system is abolished, because one thing that the examiner know, that your basics are very, very poor. You are totally banking upon the guides to get through the exam. It was all mugging up phenomena. Now examiner says all questions are not equal. Each question has got different weightage, and for that they are using 2 index. One is the difficulty index, and other is the differentiation index. Differentiation index. Now what are these two indices? So first I give you an example, then I'll tell you what and how they are using these two indexes. So first is the difficulty index and other is the differentiation index. So first of all, you should know each question is not of same marks. Suppose he asks one question. Let me give a simple example. Suppose I asked you one question. Who is the captain of Indian cricket team? Virat Kohli, Ishant Sharma, Yuvraj Singh or Zahir Khan? Answer is Virat Kohli. This question can be answered by almost 99% people can answer this question. So difficulty index in this question is very, very low difficulty. It's an easy question, can be answered by 99%. Differentiation index is again low, means I cannot differentiate who is a good student or who knows or who doesn't know, because it's an easy question. So difficulty index 0 very low, and differentiation index low because I cannot differentiate between the learned and less learned. Now I asked you one more question. Who is the Prime Minister of Honolulu? Tom, Dick, Harry, Jerry? Difficulty index very high, but I cannot differentiate who is a good student or not a good student. The differentiation index is low because 99 to 100% people cannot answer this question. So difficulty index very high, differentiation low because I cannot differentiate who is a good student or who is not a good student, or who knows or who doesn't know. To better is that all students are good. So I take my words back. I should use the term who knows more or who knows less. Okay. So now if I ask you one question, who is the captain of Indian hockey team? Now this question can be answered by only 10 to 20%. The option A, question is who is the captain of Indian hockey team? Answer is Abhijit Singh, Sardara Singh, then it is Zahir Khan, or it is Ramesh Kumar. The answer is Sardara Singh, and this question can be answered by only 20%. So difficulty index is fairly high and differentiation index is fairly high. So we really want to differentiate who knows subject or not. So the first question was, who is the captain of Indian hockey team should be 1 mark. This question, this again 1 mark. But this Sardara Singh question will be of 4 marks because only 10 to 20% people can answer. So friends, so the marking is different because in the exam, how the paper is set. Paper is set like this. Around 20% questions can be answered by about 90% people can answer those questions. They are of 1 mark. Then around 20% of question can be answered by 60 to 70%. They are of 2 marks. Then around 20% of question or 30% of questions which can be answered by 30 to 40%, 3 marks. Then around 10%, again 20% can be answered by 10 to 30%, 4 mark, or less than 10%, or around 10% question can be asked by less than 10% people. They may be on the higher scale. Got it? So each question is not of equal mark. For example, question come on metformin. This 90% people can answer this question. But in the previous lecture, I discussed so many new drugs. Even today also, I discussed so many new drugs. So if the question is asked to you regarding, maybe they talk about Afreeza. I discussed in the previous lecture. Or I talk about Pegvisomant. This can be answered by only few people. Only these people can answer this question. So they carry higher marks. Got it? Now, there is no negative marking in this. Should we do all the questions? It is true that there is no negative marking, but if you do more wrongs, like suppose there are two people, both are getting 700 marks. Both are getting, and you know very well that in PG entrance exam, 1.5 lakh students they write the exam. 1.5 lakhs, and each in 1 mark there are thousands of students. Suppose there are 1,000 people there are 1,000 people who are getting 700 marks. Now how they will do the grading? Now suppose there is one fellow who got 700 and he did not do a single question wrong, so he will get first priority in 700 category. There is one more fellow who did only one mistake in 700 category, so he will get number 2 category in 700, like this. That means more negative you do, your rank goes down in the same ranking also. So now how you should write the exam? Try to do all the question, but there are some questions where you are doubt between two answers. You should definitely attempt those questions. But suppose there is one question which you never heard, you don't know even ABC of that question, you leave that question. It's just like asking question, who is the Prime Minister of Honolulu, Tom, Dick, Harry, Jerry. We never heard this question. Leave those questions to avoid less negative marking. So again remember, each question is not of equal marks. Depending on how many people are answering those questions, and depending on that question is given the value. Got it? So this is the strategy that you have to follow. Now only few days are left for the exam. So how you should read your class notes, what you have been taught in the classes, and in the few days, like here is a road badly. Now what I'm going to discuss, what should be your strategy for the about few days. Today is this is 27th of September, when recording is being done, and I presume that your AIIMS and DNB exam are in the first week of December. So you have about 35 days in your you have about 65 or 70 days in your hand. So up to 31st of October, you should just see what are your gaps. Suppose there is one road. A road is there who has got so many potholes are there. You have Mercedes Gadi with you. You cannot drive more than 20 km/h because road is badly damaged. But somebody comes and makes a beautiful road, nice road, then your speed will go to 120. So in your strategy at the moment, whichever day you are watching this video, up to 31st of October 2015, okay, or little later also, depending on what day you are seeing, you fill up all these gaps. Sit home, talk to yourself, see which subject are weak and which topic are weak. Fill up the gap first. Then after that you start revising. The last 1 month or 3 weeks you should revise again and again. Your class notes should be your basics, and the video lecture what I'm going to give you, the previous lecture was regarding endocrine, diabetes we covered mainly. Today also second lecture, and now I have one series of lectures for you to give you all the updates. Read whatever I'm talking, note it down. You can see it again, note it down, and try to revise. See it again and again. Try to discuss with your friends so that your memory goes better. Okay, so this was the second lecture. So now we will be talking about the third lecture soon. Have a goodbye till that. Thank you very much for watching this video. Now I'll be recording more. You can see more lectures to follow soon. Immediately we are recording also. Thank you very much.